I'm Mrs. Robertson, and I help with the skills at Reese. And we have already video before did an indwelling catheter, and with this video, I'm just going to do a straight cath. We've already viewed the chart, and after viewing the chart, of course, you got to wash your hands and to get your supplies. Depending on what the doctor ordered, of course, you're going to get a straight cath kit. And in that, you're going to have to go ahead and get the sterile gloves for the procedure. So I have my sterile gloves and my straight cath kit. I'm not going to go over GID the patient and doing all that because you can see that on the first video. Also, the main thing we want to do, I'm just going to start in with the straight cath and obtaining the collection. So what you're going to do when you get in the patient's room, you are going to wash your hands before you start handling the supplies or the patient. So what I'll do, I'm going to go ahead and get the patient ready for the procedure. And so we've got the bed up already, and I've got the tray where I need it. I'm going to go ahead and just bring the trash can over here. I'll rewash the hands, and we'll go ahead and get the patient set up. I've already got the room lighting the way I need it so that we can have visualization, and I'm going to go ahead and remove the covers back. As far as privacy, always make sure that you shut the door to the patient's room and give him as much privacy as you can. We're going to pull the gown back. On the male patient, as the female, we know that we can take the legs, bend them up, and spread the leg. You don't need the legs apart that much on the male patient, and when I'm going to do for UA, I like to go ahead and set the tray, and especially if I'm going to be emptying the bladder, maybe due to bladder retention. So that way they don't have to balance the tray on their legs. If you're just going to straight cath and not have to collect a urine and you can balance it, it's fine, you can put it on their upper thigh. But for this procedure, I'm going to put it between the legs. So I'm going to go ahead and wash my hands again since I handled the patient, and we're going to open it. Now, while you're in the supply room, you should have already checked the expiration date and the bag itself to make sure that it is closed. If you want to, you can take this out and keep it, or you can throw it away. It does have a 14 French catheter on. Here's what's in this bag. If you can remember that, then you won't have to worry about it. I'm going to also, because I'm going to get a urine specimen, I've got my bag here for my urine. I'm going to go ahead and because I do have to clean the area, I'm going to just set this bag up. Now I'm right-handed, so I'm going to go to the opposite hip so that I can place my items in there. Now, I'm going to go ahead and open the kit, and it's this way. We're going to open it away from us first. I'll go ahead and turn it sideways, and then I'll kind of get my tray so that we can see. Okay. Sometimes they fold up. Okay. Now we're going to get this one, we're going to pull it back towards us. I like to go ahead and position it where it can have a little more room. On this one, I got, it does have, this one comes with gloves. The gloves are right there, so we won't need this pair. If you don't need it, it's fine, you can keep it there. Here we go, we're going to set this to the side. And then we're going to have the pad. Now on the pad, this is a blue pad. Sometimes they're blue, sometimes they're white. You can pick the corner and you can pull it out. As of before, we're going to turn it this way because we have the shiny side towards us because this is what's going to go down. I'm going to go ahead and I'm going to bend it to where we can put it between the patient's legs. This way you do not cross over the field. Leave it where it sits because if you try to straighten it and with the legs not that far apart, you probably can't get the whole pad in between the legs. Now I'm going to go ahead and come over and put my gloves on. Okay, this glove's kind of folded up on top of that one, so you want to be careful and get it where you can grab a hold of the cuff. And once you get the cuff, go ahead and place it up so you can see what you're doing. And you're going to go ahead and put on the glove. Sometimes the thumb is way down in the cuff and it's hard to get to. Go ahead and take the other glove, separate it, pull your thumb out so you don't have a chance of contaminating it. And then you got it on. We're going to come back over here to our field. We can look at the field, see what all we have in here. Here's your alcohol swabs, limitation. Here's your specimen container. I'm going to go ahead and get out my tag, because if I don't, urine will get on it, and I'm going to leave it there. Okay, it's up to you. I like to use the fenestrated. You don't have to. To me, it gives me a little more field to work with. And once again, the shiny side goes down. So here's the shiny side. I'm just going to do it this way, and I'm going to just lay it right like that, okay? So now we're ready. We can place our tray. And I'm going to go ahead and I'm going to get everything ready. I'm going to put my lid back here, and I'm going to situate my KY. And I'm going to get my catheter where I can get to it easier once I get in there. If you can. Okay. So I can go ahead and I'm going to open the package, this package first, so you can be ready. Throw that out, leave that right there so we can get to it. I'm going to go ahead and get my KY open. And go ahead and get it ready so we can lubricate. Okay. Like that. Now we're ready to move this over. I'm going to move it this way since my KY's here and my cup's there. And we're going to go ahead and we'll just put it right here. Okay, now I'm going to go ahead and once you grab the penis, the shaft, you're going to have to make sure you hold on to it, and not a tight grip but a firm grip. And once you have that grip, you don't want to let go. This hand is going to be considered the contaminated hand. Also, if the patient is a patient that has not been circumcised and they have a foreskin, you're going to have to take the foreskin back with your index and your thumb. You're going to have to pull the foreskin back. When you clean, you want to make sure you start at the tip where the entrance is and clean around the gland down. And discard. Start again, around it, and then down. Discard. So that's what we will be doing now. This patient is circumcised, but like I said, if it didn't, you will tell the foreskin will come over the gland, and you need to pull that down. Once you're through with cleaning and once you're through with straight capping the patient, make sure you clean that area and pull the foreskin back over the gland. So we're going to grab the patient. We're going to pull it straight up, okay? Now once we've got the patient, and we're going to tell him to be sure and take a deep breath and to hold it because he'll feel a little bit of pressure. We're going to go ahead, I lubricated the tip so it'll be ready. I'm going to go ahead and clean. We're going to start here and we're going to work it way down, all the way down the gland and discard. We're going to start with the tip, go all the way around the gland, and then just discard. Sorry about that. Go around, all the way around the gland, and then discard. Okay, now we got your catheter here. We do not need this anymore. We'll get that out of the way. And now we're ready to straight cap. I'm going to go ahead and put my cup back up. Now, once we straight cap, we're going to go in. If you're going to go all the way down as far as you can once you start to see urine. You may go quite a ways because their urethra is much longer than a female. A female's like 4 inches or 2 to 4, and the male's a lot further down. So we're going to go in advance. When you're doing an indwelling catheter, sometimes you'll go all the way down to the Y port before you'll start getting urine. So once we start, we're going to have a smooth, even insertion. And once you get down to a certain time, then you'll see urine come up. Once you see the urine, what you want to do is hold it so that it doesn't get any more than you need. Then we're going to go ahead and put the cup here. We're going to let go, get what you need. Once you've got as much as you need, you can clamp it back off. I will tell you, some of them are rubber tip catheters. They're a little easier to clamp off. They're a little bit more flimsier than this. This is a stiffer catheter. So you may have to work with 2 of them. I'm going to go ahead and try to put the lid on this one so that we can maybe put it out. I'm going to put my table right here and set it, okay? Make sure you don't contaminate the hand. Now what you're going to do, if you want to push this a little closer, you're going to unclamp it and just let him drink. Just go ahead and let the patient, because you're actually removing some of the urine in the bladder because of the retention. Once you start seeing him barely dribbling and stuff and slowing down, then you can go ahead and remove the catheter. You can tell the patient to take a deep breath and hold it, and he's going to feel a little pressure coming out. You're going to take slow, even movements out. Okay, you're through. It's all done. Once you've done that, then you can take this while you've got the fenestrated. This is one reason I like to have it. You can go ahead and clean off the gland. And then once you're through with that, you can go ahead, if you did have a foreskin, you would want to make sure at that time you put the foreskin back. Clean it real good. Okay, once you're through, you can take the urine in your bag. Okay, you can dispose of that. Now I'm going to go ahead and go to the bathroom so I can measure the urine that I've obtained because he had urinary retention. Also, I'm going to visualize. While I'm here, I'm going to visualize when I'm disposing of this. I'm going to visualize the color and if it was clear or cloudy and how much urine. Also, if there was an odor to a urine. So this is what you're going to do at this time so that you can document this and chart this. And especially the output since he's got urinary retention. So you would dispose of that there, okay? Come back and you go ahead and take those gloves off. I'm going to go ahead and wash my hands. And I'm going to get wall gloves on so that I can go ahead and document everything on my label and use my pen. At this time though, if you haven't already, when you cleaned the patient earlier, hadn't put his gown down, make sure you do that. And you can go ahead and cover him at this time. And then we'll go ahead and get, that way he's not exposed any longer than he has to be. I will grab my pen. It's got on here the name, the date, the time, the room number, the doctor. If it's instructions on here like this has, you can put UACNS or whatever the order read. And then you can attach that to the front right here of the patient's specimen cup. And these gloves went to it. There we go. So, what you do, you put it there. Go ahead now and you take it and put it in your lab bag. Make sure you seal the bag. And there is a pocket here so that when you actually get the order from the secretary, you can put it in there and then they can have it when they go down to the lab. So once you get that done, you've got all that, we're going to go back over here. We're going to take the gloves off. We're going to wash our hands. When you get ready then to go, let's go ahead. You can take a glove. We can get an extra glove like we have. That way you can transport this down to where you take it to lab, or you can transport it where it goes into the lab tray. Some places have that, and they have transporters. However, that facility does it. But what you need to do, you don't want to wear gloves outside the room, because if you do, no one knows if they're contaminated or not. And when you go out and when you're finished, you've already taken your lab specimen to either to the desk to be transported in the lab container or taken to lab. You need to make sure that you document in your chart on the specimen you collected. You need to be sure and document the color, whether it was clear or cloudy. You need to document how much residual was left or how much you obtained. You also need to document how much urine you collected and taken in the specimen cup. On that, you also need to document about the patient, how they tolerated the procedure. You need to make sure you document that you maintain sterile technique throughout the procedure. You also can even document that you used a straight cath and the size of the catheter in the straight cath kit. After you've documented all that, then you be sure and document that the patient was left in a safe position, in a comfortable position with brakes locked, side rails up, and call out within reach, and overhead table by bed. Thank you very much.